Good day, ladies and gentlemen. This is episode 49. We're going to talk about the healthcare crisis and capitalist exploitation, and we'll leave it up to you to decide your opinions of healthcare should be a right or it should be healthcare as a privilege for the wealthy to make money off of. What are we going to discuss to start this episode out?
Well, I think one of the most important things to remember in Alberta is they're running a provincial surplus. In other words, they have more money coming in than they have expenses going out. So the reasons for cutting back on healthcare, being that they don't have the money to fund it, is not necessarily the best of reasons. But what they're also doing is the money that they are spending on healthcare, they're spending more and more on private services that are offered by medical groups for profit. And at one time in Alberta, that was considered a no go. And the federal government at one point had even threatened to withhold transfer payments for Medicare in the event that Alberta had private clinics.
Yes.
So that changed. But the thing is, one of the key issues is when you're paying the private sector more for surgery, for example, than you are paying the public sector, and you somehow expect the public sector to survive on less while you're paying more for the private sector for the same procedure doesn't make economic sense.
Yeah,
And I,
there's a
I
lot
think,
of issue there. Like if they really had an issue with the availability, most people would be more than welcome to the idea of attending service late at night when there's availability of equipment. So let's say MRI, you can run them 24/7 with employees under government contract, and you can make that available anytime, all day long. There would be no list of waiting for the services because you can increase the access to the equipment 24 hours a day, 7 days a week by hiring the proper staff. And that's cheaper than contracting out to private industry for profit. There's a lot of issues involving the ability of capitalists to influence government to ensure that they're going to be the ones deciding what services and the level of cost to you to get those services. And I suggest that this is a systemic issue of a political system where politicians receive money in favor of making sure that the laws benefit the wealthy that fund their election campaign. Now, if we get into a little more of Alberta, really wants to be a breakaway province, and they've been really pushing the agenda for privatization of healthcare. We get into a little conundrum because there was a big scandal that is ongoing still in Alberta with the Minister of Health, Adrianna LaGrange, and the Office of AHS for firing a person investigating an issue dealing with alleged fraud, maybe alleged misappropriation of funds to procure contracts. I'm not too sure, but I think you would be able to enlighten our viewers a little more on this issue.
well, the safest way to start this is to go back to the initial pleadings of Athena. I'm going to mess up this name here, Mesolopoulos, and she issued a statement of claim in February 12th, 2025, Court of King's Bench. And it starts off by explaining that she has had a variety of government positions, both federally and provincially. She was Deputy Minister of the Treasury Board and Finance Boards in both Alberta and BC. She's obviously well qualified, and she was hired by Alberta Health to investigate, I guess, cost cutting. But just to read quickly from page 3, paragraph 8 of the claim, and you have to realize that pleadings aren't necessarily what the result may not follow the pleadings, I guess is what I'm saying. They're unproven allegations, but they're made as statements of fact. So January 8th, 2025, she was invited to attend a Zoom call with the Alberta Health Services board chair, and several other individuals. Instead, the Deputy Minister of Health, Andre Tremblay, signed into the Zoom meeting, and Connie Webster, Executive Director of the HRBP, and they basically told her she was terminated.
Well, it
Now,
sounds like a call that was misleading to get her on the call, or was she being set up to be sandbagged by these individuals, that they did it maliciously in the attempt of having her come to a business meeting that wasn't to be a business meeting?
at the very least, it's in poor taste. You know, to
Very,
set,
very
to
poor
set,
taste.
set somebody up for a Zoom call to tell them they're fired, and the people that are in charge of your department don't show up. You know, and paragraph 9 of the statement of claim essentially says that. In short, she was purportedly fired over Zoom in the absence of the AHS board approval by someone from the Ministry of Health who lacked actual authority to do so, and she was misled about the attendees of the meeting. So it goes, sandbagged is probably a a gentle way to put it.
Well, it sounds very dubious.
Well,
Now,
and well, what makes it even more dubious is she'd been hired and authorized to do an internal investigation and forensic audit into various contracts with the private uh, healthcare providers.
that sounds like a MAGA Trump thing. Somebody sniffing on their trail of a crime, and you fire them immediately to make sure there's a great cover up. That's all I see here. Now, we know that Smith has an affiliation to uh, wanting to deal with Trump and separate Canada from Canada with her movements, and she obviously loves capitalization of private health care. I just see it as a big red herring. I don't see how people haven't lost their jobs and how they could still be elected positions of being a MLA or a minister. They should have to resign on such conduct, I would think.
Well, here's the thing: she was hired or authorized to do an internal investigation, forensic audit into contracts, procurement processes, including contracts with private healthcare providers and suppliers. And of course, she was looking into a $70 million contract between AHS and MHC care, children's care. So
Yeah.
this is the type of person that you want in government, in my opinion, somebody that takes their job seriously and does what is in the best interest of not only her department, but the people of Alberta. So firing her uh, should be made public. There should be an independent inquiry into this. Now, the government will say that because this is before the courts, we're not going to discuss it. In other words, they'll use this statement of claim to clam up. And
Well, it's it's definitely something that we need to be investigated independently, but is there such a thing as independent investigation in Canada? We know that sometimes the investigators from Manitoba may not be looking in the best interests of anybody but themselves and their affiliates. I could cite a couple of cases where Law Society hired independent judges in Manitoba to cover up wrongdoings by a Law Society member that used threats or forms of extortion to try to silence people. And I was witness to that, and the claims against the individual in the Law Society were dropped. And as a witness, I wasn't even contacted for my statement by this so-called judge or arbiter in Manitoba, and the case was dropped against the lawyer. So is that independent, honest adjudication of matters? No, there's political influence behind it. So is this why the delay on the release of information on the alleged investigation, or is it just another form of covering up the wrongdoings is my question.
Well, and of course, this employee was getting unsolicited telephone calls from the Premier's chief of staff inquiring why there was a contract cap on some of these private providers. So the government was obviously hearing back from the private provider that their contract was, although being renewed, wasn't being increased. So it goes to show you that there was a backroom pipeline to the Premier's office.
Yes, and that's another issue. Now, I understand, that for profit is for profit, but shouldn't you have the interests of Albertans as a forefront reason, especially as Minister of Health? Now, I do have a story that through personal contact, when the interest of Alberta is on the table, Miss LaGrange's family did not support local business. Her husband needed to buy a piece of farm equipment that in Red Deer would have cost $800 to $1 million. Instead of buying it from a local business and supporting Alberta economy, he went to the United States and bought it for $300,000 or $400,000 and brought that equipment up here. He wouldn't be able to do that now with the tariffs, but he'd save money. He basically screwed the local business economy over by buying in a USA. And it shows the underlying morality and ethics that his wife is portraying in this case. And would there be handshake deals to enrich people that she knows? If you're lining your pockets and not doing the best for Alberta on other business transactions, maybe you would not be doing things in the best interest of Albertans on other matters. And when you start investigating some of these dubious contracts and allegations on here, it leads you to believe that it is worth investigating, but is it going to be a fair investigation? That I can't see happening, because money rules the roost, just like in the US. Mega Alberta has the ability to buy and silence judicial matters. And we've seen that. The Smith has intervened in cases where these people should have been prosecuted, and she influenced the Justice Department. So we've also seen where the Minister of Justice got away with some dubious conduct, and that in itself is showing that we do not have a fair and just legal system up here, and money rules the roost. So this will be an interesting case before the courts, I guess, to see what transpires, and that is something that we will follow, I think.
Well, one of the most interesting things from a legal perspective is that this statement of claim is verbose. In other words, usually a statement of claim is it pleads the basic facts and then nothing beyond that. And the other facts are proven in examinations and at trial. Now, in this case, this statement of claim is 17 pages, and the paragraphs are lengthy. They set out meetings, discussions, and that sort of thing, which paint a very grim picture of what's going on behind the scenes in the government at the highest levels, where you have individuals phoning up on behalf of private contractors and saying that, there are people, high people in government that aren't happy, and that sort of thing. And it's if this is happening in this case, you can be certain that it's happening in all sorts of other government issues. So I would recommend that people actually go to the internet, do a search, find the statement of claim itself, or request it from us, and we'll send it to you, and have a look at it, have a read of the high level people that are involved in protecting the livelihoods of wealthy medical service providers. Now,
Point 70 in this goes Health Minister LaGrange and Alberta Health then made a public announcement advising that Tremblay would be the interim president and CEO of AHS. News media reported that AHS had deferred all questions from CBC News to the government. The provincial government would not confirm whether or not Mentezalopa Palooza was fired, leaving people to guess whether she had been terminated for just cause. And it further goes on to point 72 that Minister LaGrange then dismissed the AHS board of directors, and in particular the directors who had supported Mentezalopoulos, however you pronounce her name, sorry about that, and the AHS investigation and forensic audit initiatives and installed Tremblay as official administrator of AHS. So to me, it sounds like there was a lot of action to cover up what was actually going on. And that's very interesting in a statement of claim, to make those allegations as part of your statement of claim too. Me not being a legal beagle, it sure paints a sordid picture of conduct of this government and the minister.
Oh, high-handed and outrageous comes to mind. Now, of course, the statement of defense denies everything and basically says that, you know, none of this really happened and there's nothing to see here. And my response to that is, if there's nothing to see here, then show us what there isn't to see. You know,
Oh, that's another Trump. That's another Trump scenario. They don't want you to see, so of course they're not going to disclose it. They don't want you to know what's going on. So that cover up says it all, folks. If you have nothing to hide, bring the evidence forward. Stand in front of the media and justify your actions. But when you know that these people are really only interested in their own pocketbooks and lining the pockets of their associates, as is the case, I just stated, where her husband didn't want to do local business and would rather have dealt with the Americans than helping support business locally. So this is a red herring, and I cannot see why people's heads haven't rolled that are elected politicians. That's
now the other thing about this is part of the dispute in uncovering, you know, the problems with the audit was over a contract for acetaminophen and ibuprofen, and we're talking tens of millions of dollars in purchasing these medications from a particular company. Now, it would seem to me that as the person in the middle of purchasing these companies, all you're doing is stepping on the actual price. Why wouldn't you buy it directly from the manufacturer? You know, it's an example of what happens behind the scenes that creates more expense for healthcare. And this isn't unusual. In Ontario, for example, the province pays private contractors $1,264 for cataract surgery, and it pays the hospital $508 for the same service. So the problem is the hospitals can't afford to expand their cataract surgery units because they don't have enough money, and so they use that as an excuse to outsource and enrich the private sector doing the same operation. Now,
but they also limit the time access to the equipment. So if they open it up 24 hours a day, 7 days a week, there'd be no backlog and there'd be no reason to have the private sector fill the void.
For example, knee arthroscopy in Ontario, the for-profit clinic gets $4,000 for the surgery, and the public hospital gets $1,200 to $1,600 for the same surgery. So now I don't know if you're getting better health care when you go to the private clinic, but I do know
they're running you through like cattle. You're just a dollar sign on your forehead, money, money, money. So you're going to be pushed through private sector getting not any better treatment. You just be pushed through faster. It's about the
Well,
money, folks,
well,
capitalism.
there was an interesting commercial on TV on the morning, news channel, local news channel, and it was about how the the hospitals are cutting back on surgeries that require radiation, X-rays, and ultrasounds, any kind
Yeah.
of testing at all. And the reason they're cutting back was because they couldn't find technicians. And the reason they couldn't find technicians were there's only 3 schools in Canada that give imaging degrees. Yet that very intro was followed immediately by a private clinic saying no waiting. If you need imaging, walk in the door and you'll get service right away. And you're going, well, how come they have technicians and
Yeah.
how come they have no waiting list? And the reason is they're getting 3 times as much money to do the same surgery.
Well, we got the same problem out in Alberta. I mean, we have shortages of doctors, family doctors. They're claiming lineups for MIRs and all sorts of medical testing and procedures. Well, folks, that's because capitalists are controlling your politician. If it's a crown corporation operating the medical field in any province, I guarantee you that it'd run more efficiently than the modeling that they've snuck in and gaslighted you people on. I could come in and change this whole system and make it very sound and there wouldn't be big lineups. It's called getting rid of the capitalist underlying conditions of the laws and the politicians that have implemented to force privatization. I mean, look at LaGrange. She's not an average person. Her family has millions of dollars. So she can go get private health care in the US anytime she wants. And probably, a lot of wealthy people can do the same thing. The idea that capitalists can run a better system, no, they can't. Look at the US. The deficiencies in a capitalist system are blatant in the US. Nobody can afford it. You lose your house, you lose everything if you get sick. The reason we implemented healthcare up here in Canada as a social program is because it saves people's livelihoods and living, and you don't have to worry about losing your house and everything because you get sick. Now, the business model, that's quite easy to solve the problem with the healthcare system. If you get rid of the corruption in the system and you don't allow these capitalists to influence politicians, you can restructure the whole industry back to where it is very cost effective and you will get full service, no problem. And I don't have a problem with capitalists in general, but capitalism is about lining the pocket of a few at the expense of the many, and they're telling you what services and what you're going to get. My issue now is that if you're going to correct the system, get some proper consultants in there to rectify the system that aren't being fed by or having their pockets lined by private interests. One of the things is doctors. I mean, doctors should be hired by the government and work for the government. If you want to open up an office in an area, fine. The government opens up the office for you and you spend your time giving service to your clients. Then you don't need to worry about the administration of your office. You don't need to worry about hiring your medical assistants and all this sort of stuff. And medical assistants would get paid more being hired by the government because it's more cost effective. When you have multiple doctors in an office, the overhead costs go down. It's much more efficient model than a capitalist could ever do because you can have the government do all your paperwork, handle all your efficiency modules like buying large volume of products so that you can service your clients easier and cost effective. That model works a lot better than the capitalist model because you can't go volume buy your necessary products you need to service your client. So when it comes to that, I mean, it'd take me a long time to go into detail, so I can only skim the surface of it for you, but I'll be more than willing to show you how you clean up the system and make it very effective, but the capitalists are going to be really pissed off with me, and rightly so, because I'll be cutting the gravy train right off at the knees. And that's what's needed in this system to get healthcare back on track. Like Cal said, Alberta, we have lots of money. We might not have any brains, which we might want to buy a few brain scan machines to scan the brains of these Albertans that allow all the money to disappear, and you get screwed up the wazoo on your own dime. But hey, you know, as a fifth generation Albertan, you know, I've had to watch stupid come and stupid go, and now we're MAGA North. I mean, we have some of the dumbest people in politics and in power, and they're financed by foreign influences and backed by the wealthy that are going to profit on you and me. I guess I could go on forever on that. So is there any other points?
Well, one of the things that is hinted at in the statement of claim fairly directly is that part of the auditor's job was to try to verify the actual owners and the controllers of the companies that are getting these contracts from the government. In other words, investigate conflicts of interest where they're issuing basically contracts to their own relatives or to their own friends or to themselves for that matter, which we have seen in the past when the past deputy or the minister gave a contract to his wife and his sister, and our ethics ombudsman said nothing to see here, you know. And the thing is, so it's rampant in Alberta. You can assume that somewhere behind all of this, somebody is getting a benefit that they're not disclosing, and they know they should be disclosing it because they're trying to hide it. And
well,
this
yeah,
employee,
I mean, you've had 50 years or more of conservative-run governments here. It's like diapers. You got to change them out, or they're full of shit. And these people are full of shit. And you see it in what's going on here, and it's all cover up and lies and manipulation, and they're playing from the handbook of the Trump MAGA organization, and it works here because it has since the National Energy Program was destroyed, costing us trillions of dollars here in Alberta and across Canada. Now they're trying to re-implement the National Energy Program because they've realized that we've been taken by the U.S., and the U.S. is not a reliable partner anymore. So Alberta has to wake up and smell the coffee, because they're definitely sniffing the shit, but they don't want to dig into the manure pile and get rid of the shit pile. That's bottom line.
well, it'll be interesting to see how this pans out, but you know the news is going to be stifled until such time as this civil case is resolved. No one's going to talk.
Well, I mean, all the judges are appointed by the government, and it's been a conservative government. The conservative judges do as they're told, or they're removed from the bench. And I'd hate to say it, folks, but our judges can be bought just like the U.S. judges. They're not independent. They're not without strings and controls, and they do have to answer to those people that appoint them, the government. And they know that the conservatives will probably be in power another 50 years, and they kiss the ring. So if you think you have independent judicial here and a just legal system, I can assure you it is not. And I'm sure I will divulge more reasons for my statements over time, because I do have lots of research and evidence of such conduct being inappropriate, folks. And that's just the facts of Alberta. So hopefully I didn't digress too much, but I do think the minister should have stepped down. There's too much evidence that she is not supporting Alberta and not supporting the interests of Albertans. The health system is a mess in Alberta because you don't want to listen to people like me or Cal to straighten it out. You deserve what you get in part, but it affects me, so that's why I'm saying there are better ways of doing it, but you got to take control away from these wealthy people that are the only voice you're ever going to hear, because media does not want to hear from people like us that say, yeah, we can correct it. I'll go in and correct it for nothing, just because it affects me directly. You hire me as a consultant, I'll fix it. That's as simple. It's easy business. It's business 101. It's not complicated, folks. The root of the evil is where follow the money. And follow the money, it's the money guys telling you what you're going to get, and they want to change the system on you so they profit and you are ripped off. Period.
Corey, you'd be fired.
I would be shot probably, and not fired. They'd have
First
to
of all,
shoot me.
first of all, they
I'd
never
open
hired
my
you.
mouth, I'd open my mouth, and I'm taking the bread train away from everybody, and I'm exposing the corruption. I'm a dead man walking, and I know that. And at my age, what do I care? So, folks, you want to straighten out? Here's your chance. I'll take a bullet. I'm not Kirk. I ain't afraid of a bullet at my age, but I guarantee you, your problem with healthcare will be straightened out right now. And there'll be a lot of pissed off people. I probably won't even have doctor anymore because, I'm affecting their bottom line too. And, if we pay for the healthcare of or the education of a doctor, and they want to go into private practice and run their own business, no problem. We can solve that issue too. The doctor brain drain out of the province or the country. If you leave the province and we paid for your education to become a doctor, then you have to pay us back, and we can set it as part of your contract for your education. And we could set it at $2, maybe $5 million to ensure that if you are going to leave, you better be a really good doctor when you leave to the U.S. for private practice, because you're going to have to make that $2 to $5 million back. And I think you're well compensated here in Canada on a pay scale, and you would probably want to stay here versus paying back your education fund under contract. So there are ways of dealing with the problem, folks. It's just get some balls and kahunas. If you got a problem, solve it. That's all I'm saying. There's nothing that can't be solved if you think outside the box and you're not on the payroll of the wealthy. I'm not on the payroll of the wealthy, so you get exactly what I say I can deliver. I will correct it. So there you go. And Cal, you know me. I like biting the bone.
Anyways, time to go.
Okay. Anything else? Yeah, subscribe, like, share. Make sure you rally to recall Smith and LaGrange from their positions. I think we got recall legislation now, folks. Maybe we should start using some of this against the perpetrators of, alleged fraud and misconduct. We can't allow it to continue.
If you had recall legislation, I'm sure they would change it before you recalled them.
Oh, hell yeah. They just passed it. They're not going to allow you to recall them, folks. They'll say, oh, no, it's against the Constitution of Alberta when they separate from Canada. Well, I can tell you what, I ain't separating from Canada, and treason is treason, folks. So, at some time you're going to have to answer to the law, and people like me will hold you right to the fire. So please empower me. Share, subscribe, and like. Spread the word. We don't have to take this bullying. We don't have to take this abuse. We don't have to be MAGA North. We don't have to separate from Canada. And we sure as hell don't have to listen to these conspiracy theorists and rebel rousers. We are not that. We are Canadian. We are friendly, peace-loving people. And it's time we started asserting our values versus those of foreigners that want to disrupt our country and our politics. Thank you for your time, folks. Subscribe. Take care.
Good day.
Bye.
Subscribe to the channel, give us a like, and please share the video. Don't be afraid to share this commercial with your friends too.